The young age, the youth, the people joints get wear and tear recently because of certain modalities. Mostly the trauma, trivial injuries which are unknown by a patient. Most of the knee joints wear and tear in younger people could be because of the early injury to the joint, and there is a trivial injury, and then there is a micro trauma to the bones ends does leads to the wear and tear of the joint. And second thing is there is a infective changes in the childhood where it damage to the soft tissue as well as the bone ends of the femur and tibia, where leads to wear and tear in the knee joint. And then there is a possibility of occupational hazards in youth leads to joint wear and tear and pains. And even certain cases of juvenile rheumatoid arthritis also, or juvenile arthritis also, where the wear and tear because of the erosions of the ends of the joint leads to the wear and tear. So these are the multiple causes where the wear and tear in the youth you could see, and you should rule out whether what type of wear and tear and what type of degenerative changes is occurred in a younger or youth group. So obviously when we know that the cause, we should take a pictures, x-rays, and then MRI, CT scan if necessary, and then certain basic blood tests to rule out to immunological disorder or in a septic disorder or an existing predisposing disease or anything. So once you rule out the exact cause of the wear and tear, and then we can treat accordingly. So most of the time young people, when there is a trivial injury, trivial in the sense childhood injuries like fall from the height, and then there is a certain times what happens, when sports activities, there will be injury to the soft tissue in the joint. That soft tissue wear and tear also leads to more friction in the hard bones of the femur and tibia, leads to degenerative arthritis. So such degenerative or such wear and tear arthritis must be treated promptly, otherwise in the future, as early as the age of 40, 50, the youth gets their degenerative joint into severe deformity and pain, thus might require to do a major surgery. So in youth, obviously, whenever there is a small trivial injuries, whenever there is a ligament or crucial ligaments or meniscal injuries, it should be treated immediately, so that the wear and tear does not increase or does provocate for the future wear and tear damage. So obviously when we see this, there is a other word we call it for the wear and tear is a degenerative, or as a continuation collision of the bone ends causes the pain, deformity, swelling, and then there is severe inflammatory reaction. So such cases we must follow it properly. We must rule out that what type of trivial injury or major injury happened during their childhood or adolescent age. Obviously, when we know the exact cause for the wear and tear, that means if there is a soft tissue injury, should treat it accordingly. If there is a subchondral bone injury, sometimes what exactly happens is there is a intra-articular fractures. That means the bone ends get fractured. There is a splinter in the articular cartilage of the bone. Such bones, if are not properly fixed, are not treated properly, then it might lead to something like a bearing, where if the chirras are damaged, the bearing gets more damage. In that sense, then when there is a articular joint is damaged, then particularly the joint end bones get eroded, and then leads to high range of wear and tear, thus causes the more degenerative damage to the bone. So you must take care in that sense. And then if it is a simple, then conservative treatment of medicines, physiotherapy does really helps to recover. If there is a major intra-articular damage or something different, then according to the age and then according to the amount of damage to the joint, will be calculated to do a major surgery like TKR necessary or not. So in this way, we should well plan the youth that if they have a wear and tear, then it should be calculated, and we should take care of the joint very well. Thank you.